Hi, welcome to another episode of The Part-Time Show. I'm your host, Dr. Kapil Amrosinghe, and today I would like to talk about academic censorship, especially in relation to the mainstream media. Why am I talking about this? What's driven this sudden need to address this topic today? Well, a month ago, a proposal came to my attention. It was called the Great Barrington Proposal, and it relates to an area of interest of mine, which is coronavirus. A bit of background: I am an emergency medicine doctor. I'm a frontline healthcare worker. So in my day job, I actively see patients and admit patients and treat patients who have contracted coronavirus, pneumonia, and coronavirus-related complications, and I manage them. And, I do the best I can with them. And some of them get better, and unfortunately some of them get worse and pass away. So, from a very personal level, I have a vested interest in discussing this topic. But I also have a very academic interest as well. I think I have a certain amount of qualification to speak with opinion and with some degree of authority. Now, let me stress this before I carry on. These views are my own. They don't represent my employer, they don't represent the National Health Service, they don't represent the General Medical Council, they don't represent anyone else apart from me. I am a UK doctor, and what I'm about to say is essentially my opinion and my opinion alone. What I feel and what I view represents a growing and somewhat underreported current of resentment against the healthcare policies implemented by the current UK government in terms of managing our COVID-19 response. I'm not going to name names. I know I'm not alone, but I can certainly say that our nation's response has appeared to be inconsistent, incoherent, and often contradictory. A month ago, this proposal came to my attention. It was called the Great Barrington Proposal, and it was written by three globally respected, world-renowned scientists. What they said was, look, we already know which groups of people are at higher risk of coming to harm as a result of contracting this disease. People with obesity, people with chronic heart, lung, or kidney conditions, the immunosuppressed, the obese. All of these people, if they contract it, they are at much greater risk of dying or developing long-term health complications as a result of coronavirus. In contrast, anyone who isn't in these groups, their risk of dying is significantly lower. Now, with that in mind, what they proposed was that any person in a high-risk group should be isolated strictly. Contact with them should be minimized, and they should essentially stay away from the low-risk groups, whilst people who would fall into a low-risk group of harm from the coronavirus should essentially be allowed to run businesses, move around freely. Essentially, there should be no restriction on the movement of these people. Now, why is that? Well, they proposed that we should aim to develop herd immunity within the low-risk group. I encourage them to catch and pass on the virus to other low-risk members of the population, with the view that once you've caught it, you become immune to it, and when you're immune to it, you're not in a position, strictly speaking, you're unlikely to spread it to other people. And if enough people catch it, and if enough people are immune to it, then the ability of this virus to spread will be severely limited, and over time, the population will no longer be at risk of coronavirus. Now, recent developments have, I feel, made this proposal redundant. The emergence of a coronavirus vaccine, I feel, is the key to making sure that both the high risk and the low risk groups can be adequately protected and can be made safe to resume normal activity. So I, for one, will be getting the Covid-19 vaccine, and I encourage anyone else to do so, because the sooner all of us are vaccinated, the sooner we will all be immune to this condition and can go back to our pre-pandemic lives. However, that's not really what I'm here to talk about. What I'm here to talk about is the response in the media at the time to the Great Barrington Proposal. It was polarized, to say the least. Depending on which publication you read, you would either get, "This is the greatest idea ever," or you would get, "Whoever proposed this idea is a sociopathic monster, and this is a stupid idea." Now, I'm a signatory on that proposal, and if that proposal came out today, in the era of a vaccine that is imminently due to be deployed, I would revoke my signature from it. But at the time when I signed it, I genuinely felt it was the best approach. And I'm going to read to you the letter that I sent to the editors at The Guardian and The HuffPost in response to some extremely derogatory articles they published about the proposal. So I suggest you listen to the transcript of this letter in full, because it contains some valuable lessons that I think everyone could learn about academic neutrality. For the people. I'm writing this letter for public posterity regarding my views on a circuit breaker lockdown, and to make some suggestions. Unfortunately, nuanced explanations on this topic are difficult, but I'll try. I'm in favour of circuit breaker lockdowns for any duration, as they will probably halt the spread of COVID-19 and allow us to get back under control before a big outbreak hits. Leave the lockdown period long enough and make containment conditions strict, and the disease may die out in the UK altogether. However, what happens when a circuit breaker ends and that scenario is achieved? The biggest challenge in my mind is that we are allowing international travel, but allowing people to quarantine from their homes on return to the UK. That's all well and good, but we are ultimately trusting they will minimise contact. Arriving travellers are still essentially allowed to live within the public and thus pose a risk of ongoing transmission. It would make sense to have dedicated quarantine centres where arrival essentially wait it out for several weeks or test negative several times before they can be let out. The practicalities of this are not fully considered, admittedly, but on the surface this seems like a better idea than what we are currently doing. It's not great for the travel industry. We are limiting direct business engagement, sure, but it would potentially allow the rest of the country to function in a pre-COVID manner. Why am I saying this? Because I've read the responses from some of the specialists in response to alternative management ideas such as the Great Barrington Proposal and feel compelled to respond. I am a signatory on that proposal. As a 9-year frontline experienced clinician in emergency medicine, acknowledging my own personal biases and viewpoints, I feel it is a reasonable idea, worth more consideration than some academics have given it. Indeed, the polarizing response from the media and these figures, whilst surprising in its intensity, should not have been unexpected. I felt angry reading some of these responses, which failed to acknowledge the secondary healthcare sequelae of intervention strategies that are primarily focused on reducing the spread of COVID-19 and minimizing its direct morbidity and mortality. If this is our primary objective, then restrictive lockdowns, social distancing, and current measures recommended by SAGE are ideal. However, if our primary objective is to minimize overall damage to our society due to this disease, i.e. reduce increase in harms due to other diseases, e.g. heart disease, cancers, strokes, mental health issues, then I believe if we continue our current approach, then when the dust settles and we do retrospective analysis in a few years, the total harm as a result of our delayed, reactive, and often semi-restrictive approach will be much worse than if we had followed a strategy already suggested in the Great Barrington Proposal, or the alternative I have just outlined. For the record, I do not think the current UK tiering system is going to work. These measures presently are an inconsistent and often self-contradictory halfway house that I think will ensure the worst of both worlds, economic and secondary healthcare sequelae and fallout, along with continued spread of Covid-19. This is because Covid-19 is a virus spread by aerosol transmission. It does not care about the time of day or the location to spread. Setting is irrelevant. All it needs is access to your respiratory tract, and if it bypasses your initial host defenses, that's it. You are infected. At that point, your risk of mortality and morbidity is determined by risk factors, which include cardiovascular status, respiratory disease, obesity, immune impairment, and diabetes. Finally, for those who might consider my views abhorrent, or who might dismiss me entirely for being an admitted signatory on the Great Barrington Proposal, this possibility, by the way, includes figureheads such as Dr. Rupert Beale of the Francis Crick Institute, whose own inflammatory response of, "It's really fucking stupid," and Professor Christina Pagel, director of the UCL Clinical Operations Research Unit, who asserted this declaration amounted to, "Let them die," both of whom inspired this response I'm writing. I ask you to consider this. Have you really experienced this on the ground level as a day-to-day frontline healthcare worker? Before you make public statements as a scientist that clearly come from a place of emotion, perhaps you should take time to readjust your viewpoint and consider it more holistically. This disease harms lives, both directly and indirectly. There is no way to engage in it in a purely scientific manner because the full data set isn't there yet. It is emerging and arriving in a piecemeal fashion from many different places. Furthermore, our approach to the data will be affected by our own individual perspectives, mission objectives, values, and the place we lie on the empathy spectrum. As such, we have to be extra cautious when responding to any viewpoint we don't intrinsically agree with, as there may be value, or at least reason, to it, which our own emotions may be clouding. The UK resistance to recently proposed measures that is starting to appear didn't occur overnight. It occurred precisely because there wasn't an adequate and diverse enough level of public consultation. Nobody asked the British public what they wanted as a collective. We've all just assumed what we want from our individual viewpoints. As such, I do not think there is any single right answer to how we best manage this pandemic. Just a lot of wrong answers, with the caveat that some answers are less wrong than others, dependent on your view. In closing, I hope you read this. I hope you consider this in full. I hope you share this with your colleagues and loved ones and ask them what they think. Only by fully and mutually listening to each other and not dismissing each other's points of view are we going to find a coherent strategy to this pandemic. Yours sincerely, Dr. Kapil Amarasinghe, MBBS, Specialty Doctor in Emergency Medicine.